Hello and welcome to ET Soonicorns Summit. I'm Miloni Bhatt. India's healthcare budget is among the lowest in the world. Nearly 65% of healthcare spending is out of pocket by individuals. We have one doctor for 834 persons. COVID-19 pandemic exposed India's creaky healthcare system, crippling shortages, and low public spending. All these statistics are not good, right? But on the other side, something else changed. COVID changed people's behavior. It forced healthcare systems to embrace telehealth. It pushed people towards digital technology to help manage their health better, and many healthcare startups emerged. It's estimated that there are about 7,000 odd healthcare startups in India. And at the base level, the aim of all of these startups is the same: democratizing healthcare access, bringing convenience by leveraging technology. And my panel today will focus on just this: the future of health and wellness tech in India. I'm so happy to have with me Vishal Gondal, founder and CEO of GOQii, which is a combination of health coaching with a smart fitness tracker powered by an integrated mobile app. Vishal, good to have you here.
Thank you for inviting me.
Next, we have with us Mr. Vaibhav Tewari. He's the co-founder and CEO of Portea Medical, which provides in-home medical care across 40 cities in India. Sir, good to have you with us.
My pleasure.
Next, we have with us Dr. Garima Sawhney, co-founder Pristyn Care, that provides advanced but minimal invasive surgical interventions. Dr. Garima, thank you for your time.
Thank you, everyone. Thanks for inviting me on this platform. Thank you.
And we have with us Koushik Rajendran, solutions architect, healthcare and life sciences specialist, AWS. Koushik, thank you so much for being here.
Hey, thanks, Miloni. Glad to be here.
All right, so let's just dive in. The first question is for everyone. So maybe Vishal, you could take the lead on it. Various healthcare reforms, such as the National Health Digital Mission and teleconsulting guidelines, combined with India's growing health tech startup ecosystem, they've all evolved to improve the healthcare journey for so many of us, right? So I want to start by asking, what do you see as fueling the growth of health tech startup ecosystem? Can you share with us some of the trends and the opportunities that you're excited about?
The traditional healthcare system is broken. It's broken primarily because it is not healthcare, it's sick care. It is designed to deal with people post their sickness and not prevent or manage conditions which can be totally avoided or managed. It's like saying that all of us drive our cars, but never service them, never change their oil, and only go to the mechanic when we get into a crash. And that's unfortunately what is happening in our healthcare system. We are the capital of diabetes, hypertension, blood pressure, you name the disease, and India is the home of millions of such patients. And unfortunately, as our population is younger, what we are going to see over the next 10 to 15 to 20 years is, as these people enter their middle and later age, we'll be seeing healthcare expenses massively rising. COVID has given us a unique opportunity to change the system to its core, wherein the idea being that just like our banking system was changed from its core post demonetization, wherein digital payments, UPI, RuPay, and an entire national and policy level change was made into the DNA of our financial system. And today we are seeing the benefits of that with digital payments reaching the new cusp. And that is what opens credit. That is what opens and gets more people in the financial system. That same revolution needs to come to healthcare, wherein we need to bring a preventative healthcare system with more stakeholders coming into the play. Data which is currently fragmented and completely in a mess when it comes to healthcare needs to be integrated. And finally, in my opinion, that people need to take charge of their own health. You have to become the CEO of your health, and you can't rely on a government or some other person, your employer, to make you healthy. You need to be healthy on your own, because it is clear that the future superpowers are not going to be countries with bombs and weapons, but countries with healthy people. So I think the government has done a fantastic initiative, and now it's up us to, as an industry and the citizens of the country, to adopt a lot of these new initiatives which are in store.
Thank you. Garima, if you could, give us your inputs on what do you see as fueling the growth of the health tech startup ecosystem and the opportunities that you are excited about?
Correct. So, see, in any healthcare system, like there are three strong pillars. One is the patient, second is the doctor, and third is the healthcare provider, right? So any problem related to them is something which all these health tech startups are solving these days, related to maybe the accessibility, affordability, you can say, about giving a quality care to them, reaching them to a tier 2, tier 3 cities in our country. I think government has done a beautiful job in landing up this initiative of Ayushman Bharat digital mission. I think its aim of developing the integrated digital healthcare infrastructure is beautiful. The Abha ID, which the government has launched, is something which will integrate the health of the person at one place. At Pristyn also, we have now started, like we have partnered with NHA and we are generating this Abha ID. And it is a very simple two-way process. Like you just need your phone number and you need your Aadhaar ID, and you can just generate your health ID over there. The second good initiative which I feel the government has launched is Heal in India. It will actually bring in a lot of international medical tourism to our country. It will make the health accessible, affordable, transparent. I think it will make their experience completely seamless from the time when they think about taking the treatment, and when they reach the country here, they can actually book their appointment. Not just this, throughout the course of the treatment, I think they will be getting good benefited health advice. Even their follow-ups when they are back to their own country, I think they will have a good backup from the government of India here. I think these are two initiatives I think is very good.
All right, Vaibhav?
So from our perspective, the way we look at healthcare now, I think there are 2-3 trends which have changed post-COVID and which are probably fueling the growth for health tech. One, of course, the single most important one is that the consumer behavior has changed. So far, maybe a couple of years back, looking at basically taking care of a health using digital medium, using technology was not that prevalent either from a patient perspective or from a doctor or clinician perspective. And I think that behavior changed significantly in last 2 years. So people became a lot more accustomed to using digital channels for accessing healthcare services, for basically getting engaged using digital, and of course seeing it as an alternative to basically in-person clinic care, basically whether in a clinic or in the hospitals. I think that's a single biggest change, because the market is much larger now. I mean, you always said that India has this large population and things like that, and which is digitally savvy, but healthcare was not the service which they were consuming using digital. I think that has changed from a consumer behavior acceptance perspective. So that, as you say, that time for health tech has come. Okay, the idea is time has come, as they say, right? So that's, I think, one thing which is the biggest change which has happened. Second is that from a healthcare perspective is that, as Vishal also is mentioning, I think consumers are looking at consuming basically or looking at healthcare services outside the hospital ecosystem. So I mean, now whether it's home care or using digital, both the things, it's possible now to not necessarily go to hospital for everything. And that became a real alternative in last 2 years. I mean, Portea did a lot of work in that space in last 2 years, given the need was there, right? And people were either in isolation or in lockdown and so on and so forth. So I would say that's a second trend which has really changed, and that's how there's so much focus and so much of tailwind for the health tech startups, saying that if you are going to treat patients outside the hospital, you need to use technology, right? If they're not in a premises, and then that's how you solve the problems, whether it's for chronic disease, whether it's for elder care, for post-operative care, anything which you look at, even wellness for that matter, all of those solving for people the problems or making sure that they're doing preventive care using technology has been fueled by that actually. So I think those are two big trends, I would say, which have changed the landscape in last 2 years.
Right. And of course, we'll be talking about the healthcare that you provided during the time of COVID, a little as we kind of move along. But Koushik, now you've heard all of these startup founders, tell us about what they're excited about when it comes to the health tech landscape here in India. What are your views about it?
Sure. If you look at, I agree to all the panelists today, what the points shared. And of course, what I've seen is pandemic has changed people's attitude towards personal health and hygiene, which accelerate the adoption of digital technologies, right? And the primary trend for healthcare industry is the movement towards more personalized and proactive preventive healthcare in effort to reduce cost and also to prevent unnecessary overcare and admissions, which also kind of increase patient and also clinician satisfaction. And some of the trends that I see is one, shift to digital health, right? More and more teleconsultations are happening, more digital interactions are happening these days. And another one is like, doctors adopting technology. There are several provider facing and also hospital facing technologies that are into picture now. I'm interacting with a variety of CIOs and like CISOs of various hospitals and also startups across India. And what I'm seeing is they have been more proactive recently in looking at technologies that can actually improve both patient and also clinician satisfaction and outcomes. And also there is a keen and acute rise of preventive health and also an awareness about it. And recently we worked with Redsheer strategy consultants and also Chirate Venture and has released a report which talks about how preventive healthcare is kind of shaping up. In fact, GOQii and some of our other startups were also kind of like, discussed over there. And next is shift of innovation from B2B to B2C. Because before pandemic and even before a few years, we would have seen a lot of innovations happening around the digital diagnostics, digital consultation, and prescription like that, right? But recently what we are seeing is a lot of innovation are happening at core workflow, which is more provider-centric or even home healthcare, wearables, is all becoming like primary part of the core workflow of healthcare itself. And finally, I also want to touch about the partner-driven ecosystem. More and more people want to buy versus build. So there is a room for everybody to build a pluggable stack that actually can go and solve someone's problem out there. And finally, also government's initiative. It's been a very important drive that actually pushes every stakeholder within healthcare community to adopt something like ABDM and also help improve patient outcomes.
Okay. Vishal, I want to take off a little from what Koushik has been telling us. Where he spoke of the shift to digital healthcare, focusing on India's wearable markets, which saw record double-digit growth in the first quarter of 2022, and almost with shipments crossing, nearly 14 million shipments, according to some data from IDC India. So when it comes to health and fitness, of course, there's some disruption, which is led by wearables. That power the remote monitoring of vitals, remote echocardiograms, and so on. Can you tell us about some of the other innovations that you see coming into this space?
So clearly, right, I think because of COVID, people's awareness of health parameters has massively improved. I think everybody now knows what is SpO2 levels and what are respiratory rates and things which were largely clinical are now become household vocabulary. And since a lot of people are aware of this data, they are also wanting to proactively measure the data itself, which is what has led to a massive surge of people wanting to know their data and know their information. And we have seen a lot of that translate into wearable devices, and GOQii's focus actually has been even at a higher level because we look at medical grade data. A lot of the cheaper devices may not be as accurate, but we and a lot of other players are even going for approval from CDSCO on the quality of data. And that takes me to the next thing. With every consumer now having access to accurate health data as well as behavior data, there can be huge benefits to them, especially when it comes to driving down healthcare costs and increasing outcomes. And for both these purposes, we've been extensively working with the insurance industry. We were part of the IRDA Sandbox initiative, and we worked with the likes of Kotak, Bajaj, Max, Star Health, and various other insurance companies who are now saying that how can they incentivize their consumers who are using their insurance plans to live a healthier life, to measure data, and then get rewarded by cheaper premiums. In fact, we just announced the launch of a massive insurance program integrated with Kotak General and Kotak Life, where every user of GOQii, depending on their health score, will automatically get a health cover. So imagine what it basically says is that if you are wanting to live a healthy life, measure all your data, there is a chance that you may never have to pay for healthcare in the future. The other big stakeholders are hospitals, pharmaceutical companies who are looking to improve outcomes. And there has been enough scientific papers to show that specifically for diseases like diabetes, fatty liver, cardiac issues, just having medicine is not going to be the solution. You need to combine the medicine with change in diet, increase exercise, sleep, stress management. So now what is happening is medicines are working in tandem with our services, that we call this the pill plus service model, where we work deeply engaged with a lot of hospitals, doctors, pharma companies, who are basically saying that how can they combine a digital therapy, medical therapy with a digital therapy and increase the outcome. And the best thing is that data is at the center of this entire activity. And this data is then used to reward the patients or customers for exercising healthy behavior. So we are literally creating the framework for the future of healthcare, which is not going to be just about prescribing pills, but it would be about changing of lifestyle fundamentally, and then using medicine to complement and supplement if you do have certain external conditions. So I think net, not just wearables, consumers in India have massively adopted to apps. You know, we use Facebook and Instagram, we are all on Zoom. So Indian consumers' expectation with healthcare apps is very, very high, because if you are using the best apps in the world, currently the part of the problem is that most healthcare apps suck because they are designed from the provider's perspective. They are not designed from the consumer perspective. So consumers, when it comes to GOQii, our products are designed for the consumers, while of course providers do use them, but they are our secondary partners. So I think the provider-centric approach will be very, very challenging for companies or health tech startups who are not really focused on the consumers as much.
All right. So, Vishal, you touched upon two things. One, of course, is how data has become centric to healthcare, and what will be the implications of it. I think we'll talk about that down the line. But also the other part about how digitization and how, this sort of push, the digital push, has really helped people when it comes to them being able to make decisions about healthcare. I want to speak to you, Vaibhav, about, how at Portea, one of the aims you say is to make healthcare more accessible, affordable, and accountable. But, during the pandemic, it was evident that people were completely left out of this digital revolution, right, which is happening in the healthcare domain, something that Vishal touched upon. One of the biggest challenges, I think, is the clinical decision support for people with chronic diseases. Other issues could be of telemedicine reimbursement coverage. What are some of the other challenges that you see, and how do you see them being tackled?
I would say from our experience perspective, I think during this pandemic time, especially because of lockdown, we could do a lot of work in home isolation, I think, but that's something which we did quite prominently along with many state governments, in fact with 7 state governments. and supported almost 6 lakh patients under home isolation, and which was done totally using only technology. I mean, it was completely done as a telemedicine program with doctors and paramedical staff supporting patients for all their requirements, and of course government supporting with all the on the ground infrastructure, because during lockdown you're not allowed to go out. Now it looks like very distant, right? But wave 1 was just 2 years back, and of course for almost 6 months we had lockdowns across the country. So I think that is something which we did, and telemedicine, of course, at that time became a lot more accepted and prevalent actually. So I would not say that that became so much of a challenge. In fact, government in COVID, even home isolation was covered by insurance. I think the first time home care service was completely covered by insurance. I think IDA had a guideline on that, and all the charges were covered. Home isolation charges were covered as part of insurance. I think that was the one big change, or basically the big change which we saw, where insurance started looking at covering home care. So I think that's something which was a challenge before. If you ask me, one thing which, if you look at home care or outside the hospital care worldwide, especially US and all, it's mostly covered under insurance. In India, given it's a nascent space, it was not covered by insurance, but COVID changed that. And of course, this year, multiple other insurance companies are looking at how they can start looking at home care to be covered under their different policies. So I would say that's one challenge was there, which got overcome big time. Second thing which we are seeing is that now, as we look at, as you rightly mentioned, chronic disease management or elder care. So there are patients or elderly who are looking at how they can leverage a comprehensive solution, right? Using technology plus on-ground support, right? So I think the way I look at it, healthcare in India will be a lot more hybrid than being only either digital or being only on ground, right? And technology gets used for a variety of reasons, including how you collect data, how you analyze data, how you basically create treatment plans, how you create care plans for each of these patients, basis their history, basis the data which you are collecting, right? And basis how they are continuously improving. I mean, look at diabetes is a good example. You have connected devices where you measure your sugar, and of course you check trends over a period of time, and then see what kind of modification has to be done in your diet or medication, and so on and so forth, on a real-time basis, right? These kind of things were not available earlier. But I would say that today the challenge is to educate the customers of having a hybrid solution and making sure that the compliance is there. Compliance is there. I think it all starts on a good note, because it's excitement around using digital and saying how we can benefit out of it. But a lot of customers are probably have to be trained, have to be basically educated, and have to be handheld to make sure they're using this solution over a period of time to see the full benefit. I mean, of course, habits changed, but I mean, you can see that with the traffic also on the road now, right? So fact is that people are just out there in full force, and some of the habits which they learned during COVID time are probably getting unlearned. So how do you make sure that they see the value of it and are seeing this through, that a hybrid solution, tech-driven solution, digital solution really helps them to overcome the problems which they have, which are for lifelong. If you're like chronic disease, it's a lifelong problem, right? You have to be alert for the rest of your life. So that becomes very, very important. Second, even elderly care side, actually now they're a lot more open to using technology. There again, education becomes exceptionally critical, right? Behavior change becomes very, very critical, because they're not used to using connected devices, right? So that's something which how you work with them on an ongoing basis, how you troubleshoot it, how you provide them on-ground support, because not all of support can be provided digitally, right? So that is something which again is very, very important now as you implement these hybrid solutions on the ground. And that's what we are looking at doing now, saying that based on all our learnings of last 8 to 9 years of using fully digital solutions, using fully on-ground solution, and looking at how we can use a digital, how a hybrid solution today, I think that's the single most important point. And not only for the patients or consumers, it's also for the caregivers, right? For the people who are on the ground working with patients, it becomes very important that they use technology, they understand the value of it and what value they deliver to the patient, right? So they all use WhatsApp, right? Everybody is on WhatsApp today, right? Everybody using all the core apps now. But fact is how some of those things get extended to using newer apps to support patients and support them in their recovery on an ongoing basis becomes very important. So I would say those are the big challenges which we need to solve as an industry going forward. So tech-savvy patients, consumers, it's all fine. They know how to use it. Younger people, they will do that. But I think India also is a land of elderly, right? we are supposed to have by 2060 or so, if I remember correctly, 25% of India's population will be 60 plus. So India, of course, is a very young country today, but also is one of the fastest aging countries as well. Correct. So India is like, I think is 110 million elderly right now. And that's growing very, very rapidly. So how do you make sure that you take care of them also as you go along? So I would say those are two big challenges to focus on right now.
All right. Okay. Garima, as the fastest unicorn in the healthcare sector with a presence in 42 odd cities in India, can you share with us some of the top learnings in your journey of building Pristyn Care? What are the takeaways in terms of the challenges that you faced, that other health tech startups can possibly invite?
See, many people ask me why you started Pristyn. So my answer to them is that I, being a doctor, a gynecologist who has worked in various hospitals like private and government, I've actually seen the patient's pain. I know how the family actually goes through when they have to undergo a treatment, a surgery or something like that. So from there, like when we were into practicing thing, right, we figured out these are the pain points, and we three were discussing on these points, and that actually took the inception of Pristyn Care. Now, when we started, there were a lot of learnings. I can say there were three things wherein we focused on. We were very much clear that what we are going to deliver on. So the vision was very clear. It is about patient care. So we were very clear that we have to bring in a similar kind of an experience all across the country with different types of hospital, different types of regions, different type of infrastructures, right? So that was a big challenge which we were facing, but we beat it by taking patients' feedback and working on those feedback regularly. I think that helped us coming out of that challenge. The second thing, which is very, very important when anyone thinks about doing a startup, is building a right team. Okay, so getting the right people at right time was, I think, is the second biggest learning. And to motivate them, to retain them is something which comes as a challenge. So when you tell them what is the purpose they are solving across, I think that challenge got something like, you can say, solved. The third thing which I can say was my learning was to understand your customer. In our case, it was the patients. So what exactly they want. So this comes as like my personal passion, which actually helped me bring in Pristyn in the system. And through my learnings, what I figured out, that whenever I used to conduct an OPD, I used to take feedback from my patients. That is something which we build in Pristyn. Today also we work where we have a proper team of 100 people who functions just around taking feedback from different people. So I think these are my learnings and challenges of building Pristyn.
All right. Dr. Garima, a lot to learn, and all watching, I think these are important and interesting insights, and will give them some help, as they go about building their own health tech startup. But my next question is for all of you, and it's something that Vishal kind of pointed to. This is about data, right? So there's a lot of focus on electronic health records. With the National Digital Health Mission, the Unique Health ID, the government aims to make patient data easily accessible between healthcare providers, researchers, policymakers, so that we can deliver healthcare of quality, and it can be delivered more affordably. Now, what are the challenges and opportunities in the implementation? When you have to ensure that patient-related data is documented in a secure and a systematic manner. How are you all harnessing the power of data, AI, ML to improve on patient outcomes? Vishal, you want to take that first?
So first of all, Miloni, it is not a technology challenge at all. There are a million EMR systems. There is everything already available and in place when it comes to centralizing data. The challenge is the conflict of interest in business models. Most hospitals have affiliations to their own diagnostic labs and companies, and they are always incentivized to make sure that patients are doing tests and retests and not really sharing the same data. And this is more, like I mentioned to you, a business model level challenge. The second challenge is that even patients don't consider their data to be that valuable. Go to any hospital and outside there, you will find a bhel puri wala who will be selling you bhelpuri on a medical report, or so I think the problem is that even patients themselves don't really value the medical records or medical data as much. So there is a behavior issue at the patient side as well as the provider side, who are not incentivized to make sure that this data is standardized in a way, which is what is causing this problem. And this is not just a problem unique to India. Many countries have faced similar challenges, which is why the approach we are adopting is the approach which is consumer centric. So we have announced the launch of the GOQii Health Metaverse, where we are saying that we will reward patients, we will reward customers to upload their medical records, to keep their data in one place, to make sure their data is accurate and validated. And these rewards will come in point of points, and these points can be fungible across various marketplaces. So I think one way to do it is to create regulation around this, which the government is working towards, so that every hospital and is trying to use, or every data and patient is trying to use the same set of data. At the same time, this is happening. The best part is this has already been solved in the financial world for a long time. We have credit scores, and a lot of banks are looking at data because they have to give debt and loans. So they want to make sure that they are able to do it. So the banking industry has done this beautifully. And this collaboration has led to a massive growth in the sector. So I think it is high time that all the stakeholders in the healthcare world and the insurance world, because these are all part of the same ecosystem, come together and agree on standards on how this can be done for the larger good of the industry and the patients.
Okay. What about you, Garima? What are your thoughts?
See, I think the opportunity is huge. As I talked before, the data, all these implementation would help in bringing quality care, will make healthcare accessible to especially tier 2, tier 3 cities. It can help in various researches in medical sector. It can bring in the precision medicine concept very advanced way in our system. But challenges for me, I think, are two. One, that it needs to means people are not aware about it and people are not ready to follow it. And if I talk about Pristyn, we have actually adopted a cloud-based EMR system, right, which helps in the need of advanced and complex technologies, right? But what it is helping with the doctor is it is helping the doctors bring in the best treatment for our patients. It is making their job more efficient. It is delivering the value-based care with this kind of technology. For patient, I think it has helped in improving the diagnosis and treatment, right? It also helps us in keeping the records. So it is helping us keeping the central repository of healthcare records for most of the patients. It helps us in bringing faster care. So we know which patient we have to say yes to, which patient we have to refuse for the surgery or delay the surgery. So all these things are helping in faster decision making, giving the best treatment to most of our patients. So we know who we have to go ahead with and who we don't have to go ahead with the surgery, or we have to get a clearance from the doctor. So I think with us, these are the most helpful points with the EMR thing.
What about you, Web? How is this impacting, and how are you using AI and ML to improve on patient outcome?
So for us, the most important thing right now is to, when we collect data, how do we basically use that data to create more and more customized care plans, treatment plans for the patients. So basically, you collect data, see their regular progress, and how do you continuously work with them to make sure that the plan gets customized? Because every patient, when you start the treatment or home care, you'll also start with the first plan which you have. But all of them respond to rehab or respond to treatment very, very differently, right? Especially in home care. So you'll always have like just to give you a model basis, the initial assessment of a doctor, you say we require nursing service with XYZ medication for next 15 days, right? And then of course you work, you see their parameters, see how they're responding. And then you continuously tweak the plan basis of data which you are collecting. So how do you customize a treatment plan? How do you basically create a treatment plan which basically gets them healed the fastest? I think is something which we are using the data the most right now. And that is something which is helping us a lot. We have our own homegrown EMR system which we have been using, and I believe that government's initiative to to basically to democratize the data as you said in the beginning, I think is a very crucial and important initiative. And the way, I mean, and of course, whether it can be, how it has to be secure, how it gets ported across different systems, across different providers. I think that that we should do as a country, maybe next couple of decades. I mean, we had the similar questions about Aadhaar when it started around 20 years back, but fact is that it has become like the go-to document, quote unquote, actually, which you use for each of the transactions now. And I think health ID and health data will probably go the same way. There's massive learning in this country across the ecosystem on how to build a system like that. And I think this is just the second thing which you're doing after that. So we're doing it for the first time in the country. I think there are a lot more doubts about it. You're doing it the second time in the country. So the learnings are there from another domain. As Vishal was mentioning about, there's so much learning about consumer behavior, consumer using data in banking and financial sector. Similarly, in collecting data and using it effectively, probably Aadhaar is a very good benchmark to use and learnings to take it from. So I would say this initiative will go a long way. Healthcare, of course, is a very, very old industry in that sense, but also very, very sunrise space from India perspective. So what you can achieve in last 20 years, probably you wouldn't have done in last 200 years, actually. So I think that's a kind of pace of growth we can see using this data.
All right. But, Koushik, taking off from what Vaibhav said, for AI to deliver in health tech, it does need the reliable data. So, how can health tech companies manage this challenge of sharing data securely? Be it electronic health records in India, any other system across the world. How can health tech startups adopt the right data analytics approach to scale sustainably and possibly in a secure manner?
Sure. I think there are many approaches in building a data strategy. I think every healthcare entity should actually come up and design a modern healthcare data strategy that's sort of like, that we are observing that many startups are doing that. So one is to, first of all, build a clear strategy on how to ingest a variety of data sources. For example, there are like now plethora of data sources coming in from, for example, wearables or internet of medical devices or medical things. And there is also data flowing in from EMR, EHR, and other enterprise systems, and data from patients who are uploading e-prescriptions and many other data sets, right? So there are many forms of data that comes into the picture. And I think we have to help startups and other customers to build interfaces that can ingest all these data seamlessly. Because it is very crucial, please, to understand like overall data architecture, and then finally how we can kind of like ensure security and compliance on top of it. Then like actually we are seeing a pattern of customers building data platform using like, lakehouse or perhaps data mesh principles that decentralizes the data sources, right? Rather like consolidating into one place. Now people are building many data lakes, and in fact combination of them from across different accounts and different regions are all combined together for better use. And then finally transformation of data. Now the data as is ingested may not be meaningful in directly using for a clinical outcome or anything else. Rather, like, there'll be certain step needed for cleansing the data and curating and like transforming into the desired outcome. And finally comes the consumption part, where the downstream use cases like clinical based decision support system, or perhaps like preventive healthcare and such use cases are built. Now, to build all of this, ensuring security is very important, and security is should be enforced at each and every step. When it comes to, for example, AWS, what we always talk about is shared responsibility model, wherein AWS takes care of security of the cloud, and our customers are responsible for taking care of security in the cloud, which means essentially the data that is loaded, stored, transformed, and processed are responsibility of our customers end of the day. So, so what happens is, doing this, we also need to make sure, like, like we follow the basic steps of making sure we are following the right privacy principles, we are following the right privacy practices, enforcing the privacy rules, and apply it at the data level, not only at the application level, but also at the data level. And 3 is also to make sure we are using services that are eligible for certain regulatory requirements. For example, if you look at AWS, we have over 130 plus HIPAA eligible services. For those customers who would want to go and meet certain requirements around HIPAA, need to use some of those services after signing BA on AWS, right? So likewise, there is always a steps that needs to be followed and ensuring compliance. And compliance and security is not like one-time job, it is continuous rather, right? And there has to be a continuous effort in doing such things. And this is where I think now I've seen a sharp increase in a lot of partners coming up with various tools in visualizing the compliance posture. In fact, if you look at even AWS, we have launched services like, for example, AWS Audit Manager that in turn helps our customers to collect evidences of all these services, whether they are meeting certain requirements of compliance or not. One such good example is whether I'm encrypting my data during transmission or encrypting the data when it is stored in some of the storages, right? So there are services that monitors continuously, and that report and evidence can be collected and shared with, like, for example, your assessors or your customers when in need. So I think we have to build that zero trust strategy, or perhaps compliance focused or privacy focused strategy in picture. And there are, like I said, tools that are like baked into AWS that we offer, and also there are partners who are offering variety of services that our customers can leverage. Overall, I also believe in ABDM stack, because even at ABDM we talk about how data interoperability is coming into picture, and on top of it, how we need to ensure privacy is taken care for patient data. End of the day, it is patient who owns the data, and we are all merely custodians of the data, right? So yeah, there is a lot of responsibility that goes into, and yeah, we need to follow that.
Just to add, we are working on a lot of the services of AWS because we are about to launch in the UK with our partners at NHS, and we are launching in many other markets. So the good thing is, previously porting applications was a huge challenge. Now I think thanks to AWS, it is definitely much easier. And thank you for that.
Thanks, Vishal.
Okay, Vishal, when it comes to, this is a policy question. When it comes to health tech, the government response has been encouraging. All of you have pointed to that. But what do you think health tech needs at a policy level and maybe at a ecosystem stakeholder level to achieve this increased connectivity adoption, while we continuously improve patient outcomes? Anything that you can think of?
See, the largest problem of healthcare is trust. The stakeholders have a massive trust deficit. Government had to implement price control for medical, for stents and all of that, right? So the pharmaceutical industry, the insurance industry, the device manufacturers. So there is a huge challenge of trust deficit between all these players. And that is what is leading to most of the problems in the healthcare world. There are many models which have been used successfully. For example, what is happening in the UK. I know that there is a lot happening in US now with what Kaiser Permanente and a lot of the other integrated healthcare offerings are doing. So I think it is not just about creating some new policy or creating some new thing, but addressing the issue at the core of solving this trust deficit. Interestingly, we had done a massive research a few years back on what percentage of people trust the healthcare system. 98% people don't trust the healthcare system. Patients, everybody wants second and third opinions. Insurance companies, people are afraid to tell because they think their claims might be denied. Whenever they go to a hospital, they always worry that they will be getting billed for services or things they may have not done. So there is a whole challenge around this. So I think that needs to be addressed before we are able to, fix all the other issues around healthcare.
Right. Anyone else has a view on this?
I might add a bit of couple of points here to Vishal. See, I personally believe in the vision of National Health Authority and its ABDM or UHI, right? And we are seeing over 800 entities signed up for ABDM stack usage, and over 40 organizations achieving various milestones and advanced milestones on ABDM stack. This is like a great indicator of how the vision of government can influence an industry at a national level, right? And we have seen how UPI disrupted digital payments industry. And I personally believe and invested into ABDM or UHI to bring such disruption into healthcare. And again, it is, I would say, personally speaking, it is a responsibility of the ecosystem. Though government is bringing in such practice, it is all of us who needs to work together in collaboration to kind of to be part of that, and also to kind of enable and educate the ecosystem in general.
And I completely believe that this is the two things, belief and the trust, which the government has to put more efforts on. But what I feel is that the healthcare servicing providers which are there presently in our country are much more ahead than the government in digital curve. And they are more better poised to drive the forward momentum for better value addition. I think government is focusing more in research and development in healthcare. And I think India can become a knowledge economy powered by cutting edge research in this particular sector.
two interesting points. Vaibhav, I have the last question now for you. During the COVID-19 pandemic, and I want to talk about profitability and sustainability. Portea helped provide home isolation services, something that you spoke of early on, and home care solutions. The pandemic demand has ebbed. Can you tell us from an ecosystem perspective, what are the scalability challenges that health tech platforms face?
I think from a scalability perspective, I would say the biggest challenge still will be to have consumers adopt it, see the value in it, and they being handheld to basically to go through the full cycle to see one to get the value added to their health and wellness, and then stick to it. Actually, I mean, not only in this, you see that across the board. So whether it's on the consumer side, patient side, or on the provider side, I think we learn behavior, unlearn behavior. And I think that's something which we are seeing in last like 6 to 9 months after COVID wave 3 got over, is that there's also massive unlearning of the behavior which got learned during COVID time. So I just basically, and when the value gets delivered, that's a reality in this. So how do you make sure that people are continuously handheld to do that, are trained to do that, are being worked with to do that? And that's why I always call it has to have a hybrid model where you use health tech to create real value on the ground and show the real value to patient or to the clinician on an ongoing basis for this to be a change behavior forever. Actually, I think the pace of change we saw during COVID time has come down, and it's very important that we make sure that it sustains with real on the ground efforts.
All right, and with the tech-enabled healthcare ecosystem, as all of you have pointed out throughout, India can truly lead global healthcare, provide cost-effective, tech-enabled, patient-centric, and build this entire healthcare ecosystem. Thank you so very much for joining me, Vishal Gondal of GOQii, Vaibhav Tewari of Portea Medical, Dr. Garima Sawhney, Pristyn Care, and Koushik Rajendran of AWS. Thank you so very much for your thoughts and for your time today.
Thank you. Thank you for calling us. Thank you.